Hey everybody, welcome to Social Media 201 for National Public Health Week. So excited to be talking to you today. I'm Lindsay Wahowiak. I'm Senior Editor at The Nation's Health at the American Public Health Association. And today we're going to be talking about how to plan your social media strategy for National Public Health Week, which starts on Monday, April 2nd, so soon. Do not be worried if you were like, oh gosh, we don't have anything ready. Today, we're just going to walk all the way through it. We're going to be feeling so good by the end of this, I promise. If you did not tune in earlier this month for Social Media 101, no big deal. That is recorded. You can check it out probably, I'm going to guess, I'm doing this, hoping that it's right next to me in the YouTube panel, hoping you can see it too. If not, it's on our YouTube channel, APHA's new YouTube channel. And this will be too, once we're all done, it'll be recorded so you can go back, reference it later, use what we've learned today on social media campaigns in the future. It'll be an exciting time for everyone. Feel free to ask questions as we go along. You can ask them in the chat here. There again should be right over here a little panel. Over here, a little panel where you can see, you can type and ask questions. I've got some folks in the room who are helping me with my Vanna White action, which is great. So you can ask questions there. You can also send them to @NationsHealth on Twitter. That's me, and I won't be able to answer them right now in the chat, but I'll be able to answer them later on. So with that, why don't we get started? I'm really excited to be talking to y'all today. I'm going to be sharing my screen with you for a little while. It's going to go a little haywire for just a second. No one panic, and I won't either. And we're going to start the show. Okay, hello. Welcome to Social Media 201 for National Public Health Week. Okay, you all know the National Public Health Week is April 2nd through 8th. So that means that's Monday. That's pretty quick. So we are going to talk a little bit about how we're going to build a plan for National Public Health Week this year on Twitter and Instagram. So why are we doing this? We're doing this to build interest and anticipation in our events, both locally and the ones that are being done nationwide through APHA and other organizations, schools, etc. Using social media helps you reach a wider audience and get people pumped up for the stuff that you're going to be working on. It also helps you to join in as part of the National Public Health Week movement. Oh my gosh, you can still see me, but you can't see my screen at all. That is frustrating. Oh my gosh, I'm so sorry. Let's just click right back so I can tell that I'm looking at you. My apologies. Let's see. This is somehow, it says it's sharing, but it's not, and I really apologize. My gosh. All right, well, let's just cancel that then, shall we? My bad. I'm going to try it one more time. We're going to see if it works. If it doesn't work, we're just going to wing it and speak audibly about what we're talking about, and hopefully things will go well in the future. So let's try it one more time. Screen share, your entire screen, share it. Screen. Slideshow from current slide. There it is. Okay, we feel better now. So sorry, guys. Okay, so why are we doing social media for National Public Health Week? We're doing it to build interest and anticipation. Really pumped about our events, really pumped about the resources we're putting out. So we want to make sure that we share that with as wide an audience as possible. And we also want to be part of the National Public Health Week movement. So we want to be seen as part of the conversation and really amplify what National Public Health Week is. So from there, let's move forward. We're going to talk about your game day / game week strategy. This is how we are really going to make National Public Health Week shine, both for the communities we serve, the people who we work with, and then also people who maybe have not thought about public health before, but everybody has a part to play. So the first thing we are going to do is we are going to build interest using hashtags. And so there are 3 hashtags I would like you to remember for this week. So the first one is hashtags with that # NPHW. So that is the overall National Public Health Week hashtag. It's going to make it really easy to find your tweets and to be promoted with other National Public Health Week participants. So the National Public Health Week Twitter account and APHA's Twitter account and other Twitter accounts are going to be able to see your tweets on National Public Health Week more easily, and they will amplify that. It also makes using a hashtag makes it easier to go back and reflect later. So if you want to see, hey, I wonder how many people we reached with these hashtags, I wonder how many people retweeted or liked what we posted, you can go back and search very easily. Another hashtag I want you to keep in mind is # 1 billion steps. So this is for APHA's 1 billion steps challenge, which culminates at the end of National Public Health Week. So if you are still logging your steps, I know I am, this is a really good way to share your progress, cheer on your teams, maybe encourage people to join your team in the last few days of the competition. And then the last hashtag I want you to think about is # NPHW chat, all one word. I know it looks a little bit wide there, the space between the W and the C. I promise there's not actually one. It's all one word, NPHW chat. So this allows you to join the National Public Health Week Twitter chat, which is on Wednesday, April 4th at 2 p.m. Eastern. And we're going to talk a little bit more about the Twitter chat in a moment. But here is an example of how to use a hashtag. So we have a sample tweet here that says, can't wait for our hashtag NPHW forum with the Surgeon General. Join us in person in DC or live online Monday, April 2nd. So here are the 3 things you need to kind of keep in mind here. So you've got the hashtag with the # NPHW, and you can tell it worked because it turned blue. So that makes that a searchable tag. So that's how you know you did it right. And then we also tagged the Surgeon General here. So this is his handle for Dr. Adams. So now he knows that we're tweeting about him. Maybe he will retweet us. So that is something you can do to tag your movers and shakers. And then the last thing we have, oh my gosh, where'd my mouse go? There we are, is the link to join the forum. So you can watch online live, or you can be there with us in person. But that's where folks can go to learn more. You'll see we also added a photo to this tweet. I didn't send it yet, so that's why it looks small. But using an image is a really good way to amplify your message. It makes it more visible in the timeline, and we're going to talk about that in just a minute. I also gave you guys a good example of how to use hashtags on Instagram. So here's an Instagram post from APHA that we posted in January. So we've got an image right here for the 1 billion steps challenge. And then we also used right here, you can see the 1 billion steps hashtag. So people can search on Instagram as well. And you can use these on Facebook too. They do not come up as easily. It's tougher to use to kind of search in a way that makes any sense. So I would really recommend them for Twitter and Instagram specifically. And you can see we also posted the NPHW hashtag. So it all comes together. All right, and if we are doing the Twitter chat, you want to use hashtags. It's really, really important. So first things first is you want to you want to use the hashtag # NPHW chat. And you will see the questions in your timeline. So go ahead, you can just follow, search for the hashtag online, and you'll see the questions. as they come up, which is really helpful. So you can see this is an answer. So you see in these tweets, we've got A1. So that's answer to question 1. So we use that so we know where you are in the conversation. You get this. You've maybe done it before, maybe you haven't, but that's why we're talking about it now. The other thing we need to use is the hashtag so that everybody knows you're part of the conversation. If you don't use the hashtag, it won't show up in the chat search. So this is the best way to keep everybody all involved in the conversation and on the same page. Great, great. All right, the other thing you want to think about, and I promised we'd talk about this, is using images to boost your visibility in the timeline and also just kind of get people excited about stuff. And I promise you do not have to be a professional photographer or graphic designer. If you've got a phone with a camera, you are ready to take pictures, you're going to be good. And if you are still not sure about that, we have tools for you. So let's get to it. Okay. So here I am going to show you a great example of using images to boost your visibility. Now this is from Instagram, so you've got to use an image there. But I wanted to show you that it doesn't have to be tough. So this is the University of Kentucky's College of Public Health. And they did a great post here on Instagram that says, National Public Health Week last year was awesome. We're so excited for this year. Here's some of the stuff we've got. And then you'll see they used in the hashtags here NPHW. And it's also a throwback Thursday because it was from last year. So that's like a fun way to kind of like play up some of the things that have been successful. You don't have to just one and done with them. You can keep using them all the time. But you can see this image is just like some nice young people holding a sign, all wearing their t-shirts. So you don't have to be, you know, a world-class photographer. You just got to be able to point and shoot. And I believe in you and your abilities to do that. It just shows, you know, you've got a nice community and people really rally around that. Okay, so next up. If you do not feel comfortable taking photos yourself, no big deal, because National Public Health Week and APHA have come together to offer you some shareables that fit perfectly for your Twitter account, your Facebook account, or your Instagram. And I'm going to show you how to get there. Please bear with me as we try to do this. All right. I am hoping you can see my screen. I hope we're good here. But so this is the National Public Health Week website. Very cute, lots of very good information here. So what you're going to want to do is hover. Do you see tools and tips right here? And when you drop down, shareables. Here we are, boom. Oh my gosh. So here we've got really good and useful tools that we can use with no need to build any graphic design or photography yourself. You can just go ahead and download them. And you can see we've got shareables for the week itself. We've got shareables for the Twitter chat on Wednesday. We have a nice one for Student Day on Thursday, April 5th. And we also have logos. These are nice banners that you could use perhaps as the banner top image on your Facebook or your Twitter account. Or you could just use them however you see fit. And you can see there's even downloading instructions. Whoops. So you don't have to, if you don't know how to do it, don't worry. It's like right here for you at the bottom. The other thing you might be saying, whoa, this feels like a lot. And how am I going to draft tweets for the whole week? Oh my gosh, you don't even have to worry about that because we have another toolkit for you. So if you go back up to tools and tips right here, and then you drop down to communications toolkit, you do not have to be a communications professional to find this to be helpful. You can see we've got all of the major moments, and you can see we have sample tweets ready for you right here as you scroll down. So you can just go ahead and highlight those and literally copy and paste. They are here for you. This is not plagiarism. We wrote them for you. We want you to have them and use them to the best of your ability. Okay, and then let's swing back to the PowerPoint very quickly. because I want to remind you that there are important accounts for you to follow along the way. So don't forget to follow on Twitter, National Public Health Week itself. So that's at NPHW. And that's the account that's going to be hosting the Twitter chat on Wednesday, the 4th. So be on the lookout. Make sure you are following at Public Health. That's APHA's main account. And that's going to give you all kinds of fun information throughout the week. And then this is just a little plug for The Nation's Health, which is APHA's newspaper. I would love it if you followed us there. Also, we'll be tweeting throughout the week. We'll be live tweeting the forum on Monday. There's going to be lots of excitement, and we hope to see you there. You can also look at the audiences, who these accounts follow and who follows them. And that is a nice way to build your audience also. Like, that's how you find some movers and shakers in public health. Okay, now it is time, hopefully, for questions. I am going to click back to our Hangout, and I'm going to stop screen sharing. So hopefully you can see my face again. So we have a question from the audience, and it is, does APHA test social media messaging with a target audience for National Public Health Week? A great question. So we have our communications team that has really been working on this messaging, and this is, I think, more than 20 years. I'm looking around for National Public Health Week with APHA hosting it. So it's been a little while, so we've really kind of honed that message in. So the stuff that we have provided for you is going to be really useful and it's gone through a rigorous testing process already. So that's hopefully answering your question. But you can certainly follow up. And it looks like we're getting another question in. Bear with me as the tech team here. Let's see, how many hashtags should I use? A great question. On Instagram, number you want to hit is around 6 is supposed to be like the magic number for an Instagram influencer. But the 3 for our National Public Health Week are really the ones that you want to really lean into the most. So hashtag NPHW with the pound sign for basically all of your National Public Health Week content for sure. During the Twitter chat, you definitely want to use the NPHW chat. On Twitter, because you're limited to only 280 characters, you don't want to use too many hashtags because that's going to not leave you much room for whatever message you want to send. So maybe just 1 or 2. Everybody likes, I think, This Is Public Health, Generation Public Health, or PH Nerd. Those are all really good public health hashtags to use along the way. Oh my gosh, we have another question, which is, has there been a Snapchat geotag created for National Public Health Week? It's a great engagement tool for youth, and it is, but we haven't put one up in DC yet that I know of. But you can geotag a very small area. If you wanted to build your own, that would be a really fun and exciting way to get people at your event to be sharing your event, or just National Public Health Week as a whole. And I think you can do a tiny little area for free. And if you wanted to do like a larger geotag, that would be not expensive, but you would have to pay some money for it. That's some like graduate level social media stuff that I think we're not going to be able to get deep into in this conversation, but happy to follow up with folks on Twitter later if you have more questions. And I see another question is coming through. Oh, what a time. This is a great conversation. A good question here, and one that I think is in line with our chat today, which is, how do I get more people to follow me? And that is a good question, and it's a tough one, right? So we want to grow our audiences always, right? Because we want to get the message of public health is good and it's important to everyone. So how do we get there? Best way is first to show yourself as an expert. So you want to make sure that you are sharing good quality evidence-based information always. And you want to post pretty regularly. At Nations Health, we post at least 3 times a day, sometimes more. On the weekends, we let it slide a little bit. But 3 times a day is like usually pretty good. We also retweet other major sources for public health information. So for example, the American Journal of Public Health is somebody we retweet pretty regularly. We also follow them. We also follow other leaders in the field. So you should make sure that you are following those leaders. If you want them to follow you, you gotta start following them. And the other thing is you should be interacting with them. So not just retweeting or liking the things that they post, but also like maybe leaving them a comment or retweeting but quoting. So when you hit the little retweet, it looks like 2 arrows kind of going like boop, 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 boop. You can, instead of just clicking automatic retweet, you can quote the tweet. So it'll show in a little box and then you can have some commentary above it, which is kind of nice. And it's a good way to like say like, this is a really important article, or I found this fascinating, or what do you think? It's really that interaction is what's going to grow your followers. One thing you don't want to do is buy followers. There's a way to do that, and it's kind of shifty, and you're not going to be getting the quality content that you really want, and it's not going to spread your message to the people who need to hear it. So that's something to keep in mind. Okay, we have another, how do you counter negative comments, especially regarding vaccinations on APHA's social media? Do you have any tips? I do have some tips. So it is sometimes tough because on social media, we've got a wide world of pretty much everybody can comment on anything. So we do occasionally get folks who disagree with public health messaging. Everything we post is based in science, so we feel pretty good about it. So there are a few things you can do. The first thing you can do is just mute them. So you can go, there's like a little arrow thingy that's probably here on your screen when you are on a tweet or somebody's, it's like a gear, it looks like a little gear on somebody's profile. And if they are posting just some hot nonsense on your page, just if they're anti-vaccination, if, you know, we get some people from, I don't even want to say it, but like the vaping community who really want to comment on things. And if they are not in alliance, if they are causing a disturbance to you, you can just mute them. And all that means is you will just never see them again. And that feels great, honestly. You can block them, but then they know you have blocked them. They won't be able to see your timeline anymore. And that is a good option too. But that also, if they are not someone who is arguing in good faith, but if they are a troll, and I think you will know a troll when you see a troll. So I don't think we have to explain too much what a troll is. If they're a troll, they might just send another account after you. So if you just mute them, that is just a lovely, peaceful opportunity to just not have to deal with any nonsense. So that is an option. Blocking them, also an option, can stoke the flames of a troll. So keep that in mind too. If someone wants to genuinely engage in a conversation and not in the I'm just playing devil's advocate kind of way, like that's not what we're looking for here. You can feel free to interact with them, but honestly, you are busy. You are probably not a full-time social media person. Likely, if you are working in public health, you wear many hats. And so I would just strongly encourage you to empower yourself to not give a hoot so much. And that is kind of what we do. We have another question, which is it possible to use too many hashtags? I would say yes. Strongly yes. On Twitter specifically, you only have 280 characters. So if you use 4 or 5 or 6 hashtags, even if they're short, like #NPHW, so that's pound plus 4 letters plus a space. So that's 6 characters you have lost already. Your message is important. You want to leave space for that. Also, think about the hashtags you're using. Make sure that they are, I don't want to say super popular, but make sure they are relevant. If no one else is using like # Lindsay loves raspberries, which I do because they're delicious, but if nobody else is using it, not relevant. But if you're just using stuff that is popular, you can go ahead and use the search function on Twitter. And that is a lovely way to go ahead and see what people are talking about, and just make sure that it's relevant too. That's the other thing, is you don't want to just see what the popular tweets are for the day. Usually there's maybe on this side also. Again, my frame of like reference is so wrong right now, but maybe this side, maybe this side. But on Twitter, there is the list of like the most popular hashtags for the current moment where you are. Don't just go hopping onto those. Like you don't really want to just, as much as you might be interested in perhaps the royal wedding, that isn't really relevant to public health. So you want to just keep it within your conversation and not try to commandeer somebody else's. I'm looking to see if we have any other questions, but I think we don't. This has been a great chat, and these have been really, really good questions. If you have more, feel free. You can leave them on Twitter @Nations Health, and I'll go back and I'll try to answer as many as I can throughout the day today. If you've got colleagues who you think, oh gosh, this would have been great if so-and-so could have been on this conversation with us, feel free to just send them to the same link you went to today, and you will be able to view a recording of this conversation. With all of our technical malfunctions and everything, it'll all be there on the internet forever. But we're really excited. Thank you so much for joining us. I'm pumped for National Public Health Week. I hope you are too. I hope we'll see you throughout the week online and during the Twitter chat. Again, that is Wednesday, April 4th, starting at 2 p.m. Eastern. If you want to prepare for that Twitter chat, you can feel free to email mediarelations@apha.org and say, I would love to get the questions ahead of time for the Twitter chat. This can sometimes be helpful as you are planning, especially if you want to make sure you can share some of your resources or find photos that might go with your tweet responses. This is a really good way to do that. So go ahead, you can email mediarelations@apha.org. We have one more question, but you can get the questions ahead of time there. Okay, the question is, do hashtags have the same impact as they do on Twitter? They do not. I don't know why, but on Facebook as they do on Twitter. I'm so sorry. Do hashtags have the same impact on Facebook as they do on Twitter? They don't really. Some people use them, but it's harder to build a conversation that way. Also, some people, like I personally, keep my Facebook account much more private than I do my Twitter accounts. So even if I was using the hashtag, and this is true actually everywhere, so you should know this. If you have a private account, that means you have locked it, so only the people you allow to follow you can see your messages. That's on Facebook, that's on Twitter, that's on Instagram. If you have a private account, even if you use hashtags, you will not show up in the search. So if you want to be boosting these things, you got to be public, which is a little bit of a risk, but it also has a little bit of a reward. So great power, great responsibility. That's my Spider-Man for you. So if you do want to use hashtags, you can use them on Facebook. You will pop up in a search, but there's not a conversation. There's not that back and forth, that sharing that you see necessarily on Twitter. Like Twitter is truly a conversation. And if you have more questions on this, I encourage you to go back and visit our social media 101 because we talked a little bit about why we would use different platforms for different reasons. So go ahead and check that out anytime. It's right there in one of these columns. I'm not sure which one, guys. I'm really sorry. But I think that's all we have for you today. Feel free to follow up with questions. You can leave them in the comments here somewhere. Well, if you are watching this later, it's going to be somewhere down here. No? We have disabled comments. Disregard that. I'm so sorry. This is a fun new update. We're doing it live, guys. If you have questions later, tweet me at Nations Health. That is the best way to find me. I really appreciate everybody joining us today, and we'll see you next week for National Public Health Week.